Hello everyone, I'm Dr. Basavaraj G S, consultant endocrinologist practicing at Bangalore for the last 5 years. Today we'll be speaking on mobile applications and smart diabetes management. As we all understand that India currently is crippled with its rising number of diabetes population. Currently 20 to 25% of people are having either pre-diabetes or diabetes. Considering the huge population India is having, we understand that this huge number is going to affect our country. So we have to deal with this problem in a smart way. India, we understand we are very quick in digital technology adaptation and usage of apps. So can we use these apps in a better way, in a smarter way for diabetes management? The answer is yes. We do have many mobile or digital apps which can come to help us in managing our diabetes more better way. What do I understand by smart diabetes management? Smart diabetes management is basically anything which you use any of the latest technologies or digital apps for managing your diabetes level. This can be as simple as measuring your sugars with the help of a glucometer and SMBG and then keeping a track of it using apps. It can also be the usage of the apps to count your calories, to count your steps, to look at the calories which are burnt out for the sleep quality and so on and so forth. There are also apps which can measure your sugar directly through a continuous glucose monitoring system which can actually help track your sugars better way. Now, how can you manage your diabetes well? With whatever we have discussed, all of these digital apps and technologies can be used to keep a good track of your blood glucose value. Keeping a track of your blood glucose values always helps in understanding how your sugars are going, which direction. Either they are controlled, either you are having an hypoglycemia or either you are having a hyperglycemia that you are on the upper side. So all of these things when put together can actually guide us for a better glycemic control and for a better HbA1c. Now, are there any apps available for the smart diabetes management? Yes, there are a couple of these apps. Many patients of mine do come and ask, Doc, tell me a couple of apps for our smart diabetes management. This is a simple Bluetooth enabled technology which helps us in managing our sugars very well. What it does is there's a glucometer where you check the sugars and then that gets transmitted onto the app digitally and saves it. So by this, the whole of tracking becomes very easy. Patients come back to me and they give me a digital tracking. Then there's a good graph also which gives me an idea of how the sugars have been, and by that we can prioritize our future strategies. Having said all of this, you must understand that all apps are not good and all apps are not meant for the ecosystem. So please go back to your consulting doctor and discuss with them that which app would be the most appropriate for your usage. One thing you must always understand that all of these apps are not mandatory, rather they are complementary. They would actually ease out the journey of the diabetes control and in a better way, easier way and in a trackable way. We must also understand that these apps actually add a lot of value for patients who are having type 1 diabetes, gestational diabetes, uncontrolled diabetes, those who have a longer duration of diabetes. These are the select group of patient populations where these apps actually help in managing the diabetes in a better way for us and also eases out the understanding of the diabetes nitty-gritties for the patients also. Doctor, give me some tips for my diabetes management. This is a very common question which I face in my OPD. One of the most important things which I keep impressing upon the patients is that all of the lifestyle modifications which we are doing has to be sustainable. Always remember, diabetes is a long journey. What you'll have to understand is that these lifestyle modifications got to be sustainable. So now if you break up all of these things, most of the people work on a trigger psychology. So they see a high sugar report, they see some complications happening, they see some reports or someone talking about the damages of the organs, then they pull the trigger. The trigger makes them change their lifestyles in such a huge drastic way that they're standing here, then they are 90 degrees. In the next 7 days, they are all charged up. But what we have to understand that eventually the charge or the motivation fades away and people usually go back to their usual self. Worse, they go back in the opposite direction because of the distress caused by completely cutting down on the carbs, completely cutting down on the sugar, completely modifying everything, and then they feel a lot distressed, feeling that these things are actually taking a lot of toll in my life. So what's the way out? The way out is you'll have to change your lifestyle more gradually. My suggestion is always aim for improving your diabetes lifestyle modification just 1% a week. 1% every week. Start from here, gradually go 1%, 1%, 1%, 1%, 1%. Over 3 months, you are close to 12 to 15% of improvement. Keep working on so many aspects. All of these aspects taken together, if you look at a whole year, they'll add on 54% improvement. Gosh, that's too much. You're way too ahead. So that is what you'll have to concentrate on. So at a given point, most of my patients come back on the follow-up 3 months. Doc, now this is getting difficult here. What I tell is, go back 2 or 3 steps. Hold on there. Now start concentrating on those aspects of the lifestyle, like it could not be just your exercises, it could be your diet, it could be your sleep pattern, it could be formation of any of the habits. So if you form these key crucial habits and keep walking slowly towards your goal, it is much more meaningful than getting into warrior mode, chalo isko lipat lenge, and all of that stuff. So this, I think, is one of the third tip which I would want everyone to keep in their mind when it comes to diabetes management. The second tip which I would always want all of the patients with diabetes to remember is that if at all you are on some medications to control your diabetes levels or your sugar levels, do not skip on your own. Many people will come back and tell me, why did you start skipping your medicines? Doc, I improved on my yoga levels, so probably I thought. I've started doing exercises, so I thought. I've started cutting down on my carbs, so I thought. So one of the best way to handle this is you start monitoring your sugars with the glucometers. Keep a track of them, and then that can actually guide you. So do not skip your medicines by yourselves. Reach out to your doctor. Ask them, Doc, now the sugars are better, sugars are on the lower side. Can I decrease the medicines? So then your doctor will come back and tell you how much you have to decrease, which medications you have to decrease. Take doctor as part of your team. We are your team. We are not against you. We both are a one team. The opposite team is basically sugars. We both together, doctors and patients, if we work together, only then we will be able to crack or beat down the bad sugars. Take charge of your diabetes management with my 3M strategy. Monitor your sugars. So what gets monitored gets measured, and what gets measured gets managed well. So start checking your sugars with the help of a glucometer, keep a track of them, and manage your diabetes well. Thank you.